Ropinirole Hcl is a medication used to treat Parkinson's disease. It can help improve your ability to move and reduce shakiness, stiffness, slowed movement, and unsteadiness. It may also decrease the number of episodes of not being able to move. Ropinirole is also used to treat restless leg syndrome, which can improve your sleep by reducing the urge to move your legs and decreasing uncomfortable feelings in the legs. This medication works by helping to restore the balance of a certain natural substance, dopamine, in the brain. It is important to take this medication as directed by your healthcare provider and at the optimal timing for the best results. When taking ropinirole for Parkinson's disease, it is usually taken 3 times a day as directed by your doctor, with or without food to reduce nausea. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. If you are using this medication for RLS, it is usually taken once daily, 1 to 3 hours before bedtime. It is important to take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or take it more often than directed. If you need to stop taking this medication for several days, you may need to increase your dose slowly back to your previous dosage. Do not stop taking this medication without consulting your doctor, as it may cause withdrawal symptoms. If you are taking this medication for RLS, inform your doctor if your symptoms increase or get worse in the early morning or if you start experiencing symptoms earlier in the evening or late afternoon. Your doctor may need to adjust your treatment. The dosage of ropinirole is based on your medical condition and response to treatment. It may take a few weeks for this medication to take effect, so be sure to tell your doctor if your condition does not improve or gets worse. You may experience nausea, vomiting, constipation, dizziness, drowsiness, weakness, unusual sweating, headache, and dry mouth while taking Ropinirole Hcl. If these effects persist or worsen, notify your doctor immediately. Ropinirole Hcl has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. You may also experience a sudden drop in blood pressure, which can lead to dizziness, nausea, and fainting, especially when starting the medication or increasing the dosage. To reduce the risk, get up slowly from sitting or lying down. Additionally, this medication may raise your blood pressure, so it's important to monitor it regularly and inform your doctor if it is high. Be sure to alert your doctor if you experience any serious side effects such as difficulty moving or walking, changes in mood or mental state, muscle cramps, decreased sexual ability, strong urges, such as increased gambling or sexual urges, swelling of the ankles/feet, chest pain, irregular heartbeat, or vision changes. It's also important to note that some people taking ropinirole have experienced sudden drowsiness and falling asleep during their daily activities without feeling drowsy beforehand. If you experience increased sleepiness or fall asleep during the day, avoid driving or participating in other potentially dangerous activities until you have discussed this with your doctor. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before taking ropinirole, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have any heart problems, mental/mood disorders, difficulty walking, kidney problems, liver problems, high or low blood pressure, or sleep disorders. Ropinirole may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, be sure to talk to your doctor about it. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Older adults may be more sensitive to the side effects of this medication, especially mental/mood changes, nausea, and vomiting. If you are pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's currently unknown whether this medication passes into breast milk, so be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Ropinirole Hcl. Some medications, such as antipsychotics and metoclopramide, may interact with Ropinirole Hcl and affect how it works in your body. Additionally, certain medications like cimetidine, fluvoxamine, mexiletine, and omeprazole can affect the removal of Ropinirole from your body. It's also important to inform your doctor or pharmacist if you are taking any products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines for ingredients that may cause drowsiness and consult with your pharmacist about using those products safely. If you smoke or have recently quit smoking, it's important to inform your doctor as cigarette smoking can decrease the level of Ropinirole Hcl in your bloodstream. If someone has taken too much Ropinirole Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. This medication is used to treat symptoms of Parkinson's disease, such as stiffness, tremors, muscle spasms, and poor muscle control. It is also used to treat restless leg syndrome. Take this medication by mouth with or without food, usually once daily before bedtime, or as directed by your doctor. The dosage is based on your medical condition and response to treatment. If you are taking this medication for restless leg syndrome, take this medication once daily, 1 to 3 hours before bedtime. If you are taking Ropinirole Hcl for Parkinson's, and you forget to take a dose, take it as soon as you remember. If it's nearly time for the next dose, then just skip the missed one and take the next dose at your regular time. Do not take 2 doses at once to make up for the missed one. If you are taking it for restless leg syndrome, RLS, and you forget a dose, then just skip the missed one and take your next dose at the regular time. Do not take 2 doses at once to make up for the missed one. Make sure to store Ropinirole Hcl at room temperature and away from light and moisture, but not in the bathroom. It's important to keep all medications out of reach of children and pets. When you no longer need Ropinirole Hcl or it has expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.